So, going back to our questions. What do EMDR, Brainspotting, and progressive counting have in common, and why are they so effective? And why do they work so fast? To answer these questions, we first have to look at why we have trauma and how we can release it. When we have a painful or distressing experience, ideally, we respond by allowing ourselves to feel our emotions fully, to grieve a loss, to feel the pain, to process the experience fully so that we can release the negative emotions. But there are times when we are not able to do that. Sometimes the experience can be so intense that we are overwhelmed by it. Sometimes we judge our feelings as wrong or bad. Sometimes we suppress our emotions. Like when we were kids and our parents told us to stop crying. Sometimes we deny our emotions because we're ashamed of them, or we simply don't know how to deal with them. We tell ourselves, I'm not sad, I'm not envious, I shouldn't be angry, and so on. Because of these things, overwhelm and judging, suppressing, or denying our emotions, we are not able to fully process the experience, and trauma is then lodged in our bodies. So, how can we release trauma? The 13th century poet Rumi wrote, "The cure for pain is in the pain." We release trauma by revisiting the painful memories, but this time without getting overwhelmed and without judging, suppressing, or denying our emotions. To prevent overwhelm, we can focus or concentrate on an external object. In the case of EMDR, it's a moving finger. For Brainspotting, it's a non-moving or fixed finger, or a pointer like this. And for progressive counting, it's someone counting out loud. And instead of judging, suppressing, or denying our emotions, we allow ourselves to totally feel them. So, by revisiting the painful memories while focusing on an external object and allowing ourselves to feel our emotions without judging, we are able to finish processing what was left unprocessed before, release painful memories and emotions, and finally heal ourselves.